mlosh Clinics is one of the topmost healthcare service providers established to redefine healthcare service and hospital environments within and outside Nigeria. mlosh Clinics started its journey into medical services provision at the Federal Capital Territory, Abuja, as outpatient care provider in September 2015 and inpatient care on a 24-hour service in October 2015 till date. Over the years, mlosh Clinic has been providing a specialized world-class urological medical practice, among other specialized medical cares, to the fast-growing Abuja metropolis, its environs, Nigeria, and the world at large. The clinic is headed by a world-acclaimed urology fellow who is also a renowned urologist with over 17 years experience.
Actually, it's a dream that came true. A dream because my people yearn for minimal access surgery. And find out that in the government settings, somehow, I don't know why, that couldn't be. We felt we have to pool resources together to, come up with facilities that we can give minimal access surgery, laparoscopic surgery, pinhole surgery, endourology surgery, where you don't cut patients, you go through the natural orifices of the body, and you do the surgery. And God, so kind, actualized the dreams, and then the hospital was able to procure laser machine, laparoscopic sets, and there we go. About 3 years ago, precisely, started. And to give God the glory, no patient came here regretted.
The clinic's unique services has earned it referrals across Nigeria and has helped prevent patients traveling abroad for medical services that are available, accessible, and affordable through exquisite modern medical facilities.
Medical tourism is actually a shame to us as a nation. Nigerians are not supposed to be trooping on a daily basis. Go to India embassy, go to Egypt embassy. 95% of people seeking visa for medical reasons. And like I said, it's not because we can't get this done here in Nigeria. We can get it done. It's because there has been no investment in infrastructure, and getting these medical gadgets are expensive beyond individuals. The government's supposed to actually, create a fund, just like they are doing in agriculture, they are doing in manufacturing, making money like they did in Nollywood, Bollywood, Kannywood, making money, federal government making money available, state government making money available for this group of individuals. As a nation, for us to curb tourism, Nigeria needs to make a conscious effort, identify people, to invest in medical practice. That way, we'll be able to curb medical tourism. Like I tell you, in mlosh, people are coming to know, why are you traveling to Germany, Egypt, India? You can get it done here. As a matter of fact, I tell you of a patient who got his medical report sent to Germany. And when the Germans saw it, they said, no, you have no business leaving Abuja. Go and see MC Kalba. He will sort you out. So they emailed him and copied me, and he was shocked. He said, oh, so this guy is even known in Germany? And then 45 minutes, we did his surgery. We're like, wow. So the people would have taken me to Germany, and how much? They were costing him 28,000 euro. So you can imagine how we are losing when we can get this thing done. And again, except we build confidence in our system, people will not stay back to patronize us. Except we convince the society that we can give them this thing in a serene environment, without confidentiality, with expertise, and they begin to see results, reversing medical tourism will be a big tax for this country.
Its range of services and expertise spread beyond the Federal Capital Territory to Lagos, Maiduguri, Sokoto, Calabar, amongst other states. These services are specialized in nature, with great emphasis on endourology and general urology, which includes female urology, reconstructive urology, andrology, pediatric urology, neurology, urologic oncology, laparoscopy. mlosh Clinic also offers special services like obstetrics and gynecology, pediatrics, internal medicine, family medicine, general surgery.
Permit me to tell you what we do exactly here. Endourology means that you treat surgical urinary condition without cutting patient with knife. So we go with our miniature equipment through where we pass urine to reach the bladder. If there is a pathology there, say bladder stone, we use our laser to just break the stones and wash them out. No blood, no cut. If it's in the ureter, then we follow the stone to the ureter. We do the same. So also, if the stone is in the kidney, we go up there in the kidney, we do the surgery, and we come out. And this is the treatment you get anywhere you go in the world. So mlosh said, why not in Nigeria? That is why, yeah, mlosh was able to, and we're poised to change the narratives about medical care in Nigeria.
Urology is basically, as I said, surgical specialty that involves the urinary system. We also specialize in pediatrics, obstetrics and gynecology, internal medicine, general surgery, and endourology. Endourology has to do with minimally invasive procedures, basically to tackle stones in the urinary system.
mlosh Clinics is proud to be amongst the pioneer centers of excellence for minimally invasive procedures in Nigeria.
Apart from being the pioneer of endourological practice in Nigeria, we believe a serene environment is very important in patient care. We travel out of the country, we see how neat, how clean hospitals are. You love to be. Why not here? That classical smell we get when we enter hospital, it's not normal. No hospital is supposed to smell. And that is what mlosh is here to define. You could experience that. You won't know you are in a hospital. So mlosh came with the concept of family care because all mlosh wards are private. The patient has his bed, the patient relation has a bed, should be very comfortable. Because we're Africans, we can't separate families, unlike in Europe, where at the gate, the hospital receives your patient and the wife and husband can go back until you are called to come and pick your patient. We don't. So we try to bring that together. And I tell you, mlosh has unified many families here.
mlosh Clinics ultimately aims to be a world endurology training center for potential urologists to get world-class standard training and acceptable best practices of international recognition.
Basically, we're trying to establish coverage because we have realized that despite the fact that we provide these beautiful services here, not a lot of people know that these services are accessible within the country. A lot of people still go out of the country to access these very services that we offer here. So our aim for the rest of the year and basically for a huge part of 2019 is to establish coverage, to establish publicity, to make people know that we are in existence so they don't have to spend the millions and go out of the country when they can get those same procedures done here within the country.
The clinic is also involved with the National Health Insurance Scheme, as well as concerns over the Nigerian health sector and its healthcare service delivery.
With the fact that the National Health Insurance Scheme is a beautiful scheme. The idea of the scheme is a beautiful scheme. It's a beautiful idea. It was birthed from a wonderful idea because the aim of the NHIS was to ensure that the average Nigerian can access healthcare without the burden, the financial burden of health. Because the truth of the issue is that health is expensive. Yes, being healthy is actually expensive. If you even want to eat and remain healthy, you spend a lot of money doing that. So the NHIS scheme, the idea is beautiful. But yes, we all know that it has challenges. It has issues that it's facing right now. And I think these issues, well, there are a number of them. First of all, we have the inadequacy of the legislation that enacted the scheme in the first place. There are a lot of things that legislation, that Act 35 of the 1999 Constitution, there are a lot of things that it did not tackle. And it has not been reviewed, it has not been amended up until this date. So we still have those issues there in that. Secondly, we have inadequate funding from the government of the scheme and the health sector, the health facilities, the providers, yes. So you're not funding the health facilities properly, and you're not funding the scheme properly. Thirdly, we have poor implementation. The implementation of the scheme itself has been poor. It has been really poor, and I think this stems from the first 2 points that I raised about the scheme. Fourthly, we have the fact that there are some practices by both the scheme, the HMOs, that's the health maintenance organizations, and the providers that are not proper, some improper practices by these 3 facets that need to be curbed, and this can only be curbed by regulatory bodies, as I have mentioned earlier. If we look at these challenges one after the other and tackle the problem, first of all, amending the scheme, okay? Secondly, looking at implementation coverage. The scheme only covers 3% of Nigerians, as opposed to the 97% that is not covered. So where do people find health? Where do they get health care from when they are not covered? Nobody is talking about the informal sector, because the scheme only covers the formal sector. You have to be working in some organized business before you get covered by the scheme. What of those who are not working in an organized business? What of businessmen in the market and people like that in the informal sector? They're not covered by the scheme. So all these need to be put into consideration.
mlosh clinics, total health care.